Welcome to LV Scary Stories, where real encounters with the unknown come to life. Hospitals are places of healing, but they are also where life and death meet. ICU nurses and CNAs witness things that defy explanation. Patients predicting their own deaths, seeing long-lost loved ones, and sometimes spirits that refuse to leave. Tonight, we bring you 5 chilling ICU ghost stories from a healthcare worker who encountered something truly terrifying. A haunted hospital room where a spirit lingers, and an unexplainable light appearing moments before a patient's passing. Turn off the lights, get comfortable, and prepare yourself for these eerie true stories from the ICU. Story number 1. I worked in the ICU, and one day we admitted an elderly patient who was brought in from home. Let's call her Patricia. She wasn't placed on a ventilator, but she was admitted to my unit due to her unstable low blood pressure. She had a wound on her lower back that was so deep it reached the muscle and bone. Even the nurse in the ER reported the case to Adult Protective Services because it was likely a case of neglect. Her family had probably not taken care of her, as the wound was severely infected. Unfortunately, Patricia's infection became so severe that she went into multiple organ failure. Her wounds were so bad that, at times, it seemed like she had soiled her adult diaper, but it wasn't feces. The drainage from her wound had a terrible smell, similar to that of waste. I remember when Patricia passed away. It was during my shift, around 11 a.m. She had already been having a rough night, and the doctors didn't think she would make it until morning, but she held on until my shift before she finally passed. The smell in the room was awful, and I felt bad for her. Her family wasn't present at her bedside, and we struggled to get in touch with them. I wasn't sure if they were avoiding us because the hospital had reported them to Adult Protective Services. Typically, when a patient dies, we give the family time to say their goodbyes, pray, or perform any religious rituals before we clean the body and transfer them to the hospital morgue. But since Patricia's family wasn't there and we couldn't reach them, my coworker and I decided to bathe her one last time before tagging and bagging her. I remember as we wiped her down and turned her, my coworker caught a glimpse of the wound through the soiled dressing and started gagging. The smell was unbearable. After washing her thoroughly, I sprayed her with a nice minty perfume and did my best to make her look presentable. Just as we were finishing up, another coworker knocked on the door and told us that Patricia's family was waiting in the hallway. I was surprised. They hadn't answered our calls, but maybe they had listened to the voicemail we left. We brushed Patricia's hair, dressed her in a fresh hospital gown, and covered her with a blanket. We made sure she looked as dignified as possible before allowing her family into the room. My coworker and I stepped outside while they had their moment with her. After they finished and left, we took Patricia down to the hospital morgue. That night when I got home, I immediately jumped into the shower. But when I stepped out, I noticed an awful smell lingering in my room. It was eerily similar to the scent of Patricia's wound. I got goosebumps because I hadn't noticed the smell earlier when I first arrived home. Then suddenly, I felt a strange warmth surrounding me. Within moments, the foul odor transformed into the same minty scent of the perfume I had put on Patricia earlier. I was a little scared, but just as quickly as it had come, the smell disappeared. I don't know if Patricia had followed me home, or if I had unknowingly brought the scent back with me after my long 12-hour shift. But I like to think that Patricia came to thank me and say goodbye. Story number 2. As an ICU nurse, we don't experience death the same way hospice nurses do. Often, our patients pass away while on a ventilator, unresponsive and sedated. However, not all ICU patients are placed on ventilators. Occasionally, we care for dying patients who are not sedated or intubated. In other words, they are fully awake. For those of you listening, you may wonder why ICU doctors and nurses prefer to sedate patients. The reason is to prevent them from pulling out their breathing tubes and, more importantly, to spare them the misery of being awake while on a ventilator. If I ever needed to be on a ventilator to recover, I would want to be sedated too. Anyway, one day, an elderly patient was transferred from another unit to the ICU due to sepsis caused by a urinary tract infection. Her blood pressure was dangerously low, requiring vasopressors to keep it stable. Because of this, she was sent to our unit for close monitoring. The patient was a 91-year-old woman named Sandra. Sandra was a little disoriented due to her age and infection, but she was still able to hold conversations and make sense of things. As her condition worsened, she became more confused and frequently asked the staff, "Is Kim here yet?" Or, "When is Kim going to be here?" We had no idea who Kim was, perhaps a daughter? When Sandra's family was at her bedside, we asked them about Kim, and they told us that Kimberly was Sandra's sister. But Kimberly had died in a car accident back in 1997 while on her way to pick up Sandra. After learning this, whenever Sandra asked, "Is Kim here yet?" we simply told her that Kim wasn't here yet. A few days later, Sandra required even more medication to maintain her blood pressure. By this point, she was sleeping most of the time, and her breathing had become labored. However, since she was 91, her family chose not to put her on a ventilator. Instead, they opted for anti-anxiety medication to keep her comfortable. I remember being in the room when Sandra's daughter sat at her bedside. I gently woke Sandra and told her I needed to give her a shot in her abdomen to prevent blood clots. She woke up, saw her daughter, and smiled. Then she said, "You just missed her." Kim was here. She and I had lunch together, and she said she'd be back to pick me up at 4 p.m. so we can go to the casino. Sandra's daughter teared up, but simply nodded and told her mother to rest and breathe until Kim returned. That afternoon, more of Sandra's family members gathered at her bedside. Sandra passed away at 4 p.m., or to be exact, at 4:17 p.m. I wasn't surprised. Some people do seem to know when they will die. What saddened me most was that Sandra had been waiting for Kim since 1997. As a nurse, I have friends and coworkers who have worked in hospice care. Every patient experiences death differently. Some slip into a coma for a day or two before passing. Others start seeing deceased loved ones before they go. Some report seeing a bright light. And then there are the ones who are terrified. Those are the ones that haunt me the most. A few have even whispered, "Don't let them take me." Sometimes we have to give them anti-anxiety medication to help calm them down, or even sedate them so they don't thrash around and hurt themselves. As nurses, one of our most important jobs is to help patients in their final hours, ensuring their journey is as comfortable and peaceful as possible. Thank you for listening. Story number 3. I've worked in the ICU as a CNA for many years now. I've encountered some strange things, but there were 2 occasions so eerie that I still remember them to this day. Usually when strange things happen, it's the patient saying or seeing things that aren't there, or someone predicting their own death. Just the usual things that healthcare workers often encounter in this field. I still remember the first time I experienced something truly bizarre in the ICU. I had been transferred from the telemetry floor to the ICU, and at the time, the only available position was on the night shift. I figured I'd stick with nights for a while and transfer to days when an opening became available. When I first started in the ICU, I wasn't aware that Room 4 had a bad reputation. The reason? Many times patients placed in that room would suddenly deteriorate, becoming critically unstable, and no matter what we did, we couldn't save them. One night around 1 a.m., the other CNA, Sarah asked if I wanted to take a lunch break. I told her I had just snacked not too long ago, but if she wanted to go, I'd cover for her. She went to her break, leaving me as the only CNA on the floor along with the nurses. I was making my rounds, peeking into each room until I came to room 4. Inside, I saw a patient sitting on a chair beside the bed, wearing a hospital gown. Her bed was still neatly made, as if she hadn't lain down in it. Her gown was dirty, as though she had vomited on it, but she was asleep in the chair. I walked in, gently woke her, and asked if she needed help. I told her I could assist her into bed since she was sleeping in an uncomfortable position. She agreed, so I told her I'd grab a fresh gown and some washcloths and be right back. I stepped out, went to the clean utility room, and gathered the supplies. But when I returned to room 4, the woman was gone. I looked around but didn't see her. I even checked room 3 and room 5, but she wasn't there either. Confused, I walked over to the nurse's station and asked Nurse Brian, "Did you see the patient in room 4? I just saw her sitting in a chair with vomit all over her gown. I went to get a clean one, and now she's gone." Brian gave me a strange look, and suddenly his eyes welled with tears. "There's no patient in room 4, he said. "That room is empty. Did you just see a ghost?" At first I thought he was messing with me, but then he explained that room 4 had a bad history. A few nights prior, a patient had been admitted to the ICU and placed in that room. She was extremely non-compliant, repeatedly removing her wires and heart monitor, despite having severe congestive heart failure. Later that night, they found her dead, sitting in a chair beside her bed. Vomit covered her gown. Brian wasn't joking. The goosebumps on his arms were visible. That's when I realized room 4 had a reputation for a reason. From then on, I learned that they only assigned patients to that room when there was no other option. When Sarah returned from her break, I told her what had happened. She confirmed that no patient had been assigned to room 4 that night. She also backed up what Brian had told me. It was beyond strange and terrifying. The second eerie experience I had in the ICU happened one night while we were coding a patient. We had to resuscitate him multiple times. His heart kept stopping, and we performed chest compressions, administered IV meds, and took turns trying to save him. Since he was still young, only in his late 50s, we kept pushing. We ended up coding him 4 times. But during the 4th resuscitation attempt, something strange happened. A glowing white light appeared in the room. It was like a firefly, but bigger. It floated in, circled above the patient, and then exited through the window. The window was closed, yet the light passed right through the glass. It was so surreal. We weren't able to bring the patient back after that. He died. Everyone in the room saw the light. We were all in shock. I have no idea what it was, but it was one of the strangest, creepiest things I've ever witnessed. Story number 4. I worked in the ICU. One day, we admitted a woman from the emergency department to our unit due to extremely high blood glucose levels. Her blood sugar was in the 700s. She was placed on insulin and required close monitoring with frequent blood draws. Her name was Tricia. Tricia was assigned to me and placed in room 8. I also had another patient in room 9 who was on a ventilator. The patient in room 9 was a widow named Beverly. Since Beverly was sedated and on a ventilator, she didn't use the call light or make requests. She was critical but stable. Tricia, on the other hand, was a handful. She constantly became upset because the doctor wouldn't allow her to eat or drink anything due to her abdominal pain and high blood sugar. Like most patients in DKA, diabetic ketoacidosis, Tricia was very drowsy and would often fall asleep mid-sentence. Because of this, it wasn't safe for her to have anything by mouth. However, every time she woke up, she would scream for help. When my coworkers or I entered her room, she would ask for water. We reminded her that she was receiving fluids through her IV and that due to her abdominal pain, she couldn't have anything by mouth until the pain resolved. That night, Beverly in room 9 wasn't doing well on the ventilator. Her oxygen saturation kept dropping, requiring higher ventilator settings. Her vital signs were unstable, and her blood pressure continued to dip, which required more medications to stabilize her. After I managed to stabilize Beverly, a coworker took over my patients and sent me on my lunch break. At 2 a.m., I returned from my break and heard Tricia screaming. I was relieved to see that she was awake after Beverly's condition had kept me busy earlier. I entered room 8 and asked Tricia if she needed help. She looked scared and told me that she had woken up to find a man in her room. The man had apologized, saying he was in the wrong room. He was looking for Beverly. Then he left. After Tricia calmed down, she complained that her mouth was too dry and asked for some ice chips. She told me that her abdominal pain was gone and she felt better. I went to get her a few ice chips, and as I watched her carefully to ensure she wasn't choking, I noticed several of my coworkers rushing into room 9, where Beverly was. I peeked my head out and asked one of them what had happened. My coworker told me that Beverly's heart rate had suddenly dropped into the 30s. After confirming that Tricia was doing fine with the ice chips, I went into room 9. My coworkers had already maxed out all of her IV medications in an attempt to stabilize her. But Beverly was a DNR, do not resuscitate, so all we could do was keep her comfortable. I asked my coworker if anyone had come in to see Beverly while I was at lunch because, according to Tricia, a man had entered her room looking for Beverly. My coworker looked puzzled and said, "No one has come in while you were gone." Shortly after, we lost Beverly's blood pressure. Soon she flatlined and passed away while still on the ventilator. To this day, I still wonder about the man Tricia saw, the one looking for Beverly. Since Beverly was a widow, I can't help but think it was her late husband coming to find her. Story number 5. I've been an ICU nurse for years, and I've seen my fair share of patients slipping away. Death isn't new to me, it's just part of the job. But there's one night I'll never forget, one that still gives me chills whenever I think about it. It started with a patient named Mr. Langley, a frail elderly man admitted for multi-organ failure. He was unresponsive, barely hanging on. His family had already said their goodbyes, and we all knew it was only a matter of time. I was assigned to his care that night, checking his vitals every hour, making sure he was as comfortable as possible. At around 2 a.m., I was in another patient's room when I heard something over the intercom system, a soft, raspy whisper. It was faint, but I could just make out the words, "Nurse, help me." I froze. The voice was coming from Mr. Langley's room. I rushed over, expecting to find him in distress, maybe gasping for air or struggling. But when I entered, he was exactly as I had left him, unresponsive, his breathing slow and shallow. His monitor beeped steadily, his oxygen levels low but stable. I stepped closer, feeling uneasy. That's when I heard it again. "Nurse, help me. Please." The whisper was so clear, so close, as if someone was right behind me. I spun around, but no one was there. The hair on my arms stood up. I reached for the call light system, wondering if maybe the intercom had malfunctioned and picked up another patient's voice. But Mr. Langley didn't have a call light. He wasn't even conscious. I tried to shake it off and continued my rounds, but that feeling of being watched never left me. An hour later, I was at the nurse's station when another call light flickered on. Room 16. Mr. Langley's room, That was impossible. I turned to my coworker. Did you see that? She frowned. Yeah, but he doesn't have a call button. We both stared at the blinking light for a moment before I forced myself to go check. As I entered the room, the air felt thick, heavy, like something was pressing down on me. Mr. Langley's eyes were open now, wide and glassy, staring straight at me. His lips moved, but no sound came out. Then, just as suddenly as he had woken up, he took his final breath. The monitor let out a long, drawn-out beep. I stood there frozen, watching as his body went completely still. I called the doctor to pronounce him, but even as I stepped out, I swore I felt something brush past me, like a cold gust of air rushing out of the room. Later that night, after the body had been taken away, I passed by room 16 one last time. The door was slightly ajar, the bed empty, and in the silence of the ICU, I swear I heard it again. "Nurse, help me." But there was no one there. That's all for this video. Thank you for making all the way through and supporting my stories. Have a wonderful day or night.